Welcome to Hump Day Happy Hour, hosted by Dentists in the Know, the webcast where dentistry meets real talk, real news, and just the right amount of sarcasm. We're pulling back the curtain on the industry, talking to the experts, the innovators, and the everyday clinicians, the ones that are out there doing the work. There's no fluff, no filter, and definitely no sales pitches disguised as education. So if it's happening in dentistry, from clinical insights to regulatory curveballs or the latest scandal at the ADA, we're probably already talking about it. And yes, we are bringing the goods. So whether you're a seasoned doc, part of the dental team or industry, a curious consumer, or maybe you're just here for the banter, we welcome you all to the show, because around here, we're not just in the loop. We are in the know. Hey there, Dinks. I'm Dr. Jeff Horowitz, and with me tonight is Dr. Jennifer Bell. You will get to see Dr. Chad Duplantis tonight, but he's not here right now, ditching out, I think for good reason, because his son has a comedy presentation, I think, going on. So pretty excited about that. But together, Dr. Chad Duplantis and Dr. Jennifer Bell and me, we do this little thing called Hump Day Happy Hour every single week. We're glad you're here to join us. Tonight, we have a show that is sponsored by the American Academy of Cosmetic Dentistry. We have an incredible interview coming up, and we're going to be talking a little bit about the AACD's upcoming meeting in April in Aventura, Florida. So with that, we are really excited to get into the show. You may notice later that Jennifer and I might be dressed a little bit differently for the interview, and that's because the person that we were interviewing, Dr. Miguel Stanley, incredible clinician who we'll introduce later, he is actually from Portugal. And so with the time difference, we decided to pre-record the interview. Otherwise, he'd be talking to us at 1 or 2 in the morning or something like that. And anyway, we had a really, really nice time. Great interview. We'll get to that in just a little bit. But for right now, I'm going to bring up mi amiga. Do you say amiga if it's a girl?
Yeah.
Yeah.
Amiga. Yeah.
Yeah. I don't speak the Espanol.
No habla español? Just skittish?
No.
Or what is
Je
it?
parle français. Je parle français un peu.
A little?
Yeah. Un petit peu.
Un petit. Okay, this interview, I'm glad you let the cat out of the bag. It is a pre-record because he is in Lisbon, but holy crap.
Yeah.
Normally there's excitement coming into our live shows because we don't know where it's going to go. We don't know how organically the conversation is going to be. But now we know how amazing this interview was, and quite frankly, how amazing he and Amanda are, and the program that they're going to be putting on at their annual meeting in Aventura, Florida in April. There were times where the three of us are speechless. And if you watch the video on YouTube after we post it tonight, you're going to see there are just times where we're mesmerized, as if we're sitting in his audience, just soaking up him as a keynote speaker, which is fun to be sometimes, just the audience and sort of taking in other people's craft, of what they're really good at doing.
Yeah.
So I'm excited.
Yeah, no, all great points. I mean, truly. And I was going to say that, it was one of the few times I ever remember the three of us just sitting there like.
You could have given us popcorn and we wouldn't have asked another question.
Yeah,
Not
like
one more
literally
question.
that might have been the easiest job we've ever had.
Yeah.
Because honestly, he was just so filled with passion for what he does and great insight too.
Yeah.
Like some of his perspective really was just like, I mean, I wish I had, heard more people like you really, really early in my career. And so it was interesting kind of strolling down memory lane, talking about some of the some of the people that have influenced all of us
Yeah.
and have impacted our careers in a very positive way. But between Amanda and Miguel, it really, it was just the perfect recipe. Y'all are going to just love this interview. And if you're really smart, like we are planning to be really smart and all be there for that conference, because I just cannot wait to be educated by him for whatever the time allotment is for him to speak. But I'll probably be there an hour before and stay an hour afterwards listening to the questions, because
It sounds like he enjoys a hump day happy hour as well. And, is also the kind that might find himself hanging out afterwards to chat over a coffee or a glass of wine.
and that's kind of what I thought.
Yeah.
So good point on that. Well, we've
Yeah.
got a huge interview that we want to get to,
Yeah.
but we also want to get to some news. So JB, you want to cover that?
I got you, boo, as
Okay.
always. All right, just a couple of things that I think are important for us to note. For all of my ADA members out there, I don't know if you remember in 2024, they did a nice little dues decrease. They dropped it down. They were lowered by $30 in 2024 from 600 to 570. Well, hope you enjoyed that little holiday, as they are now proposing for the House of Delegates in October to increase the dues back to the $600 and also add a 3% increase on top of that. I know dues increases are always contentious, having been in organized industry for a really long time. That's always a really difficult conversation to have. This is going to be exponentially more difficult because it has become apparent over the last 8 months about some fiscal challenges that the ADA has had and maybe some misuse of those dollars. So there is definitely a marketing problem to be had with the dues increase. It will be really interesting to see how the House of Delegates handles this particular proposal and what, frankly, the leadership of the ADA will do to ensure that that extra revenue coming in will have good intention for spending. So I do think this definitely probably will be one of the must-sees House of Delegates. I'm actually somewhat tempted as an ADA member to grab a box of popcorn and attend myself in the peanut gallery just to be an observer. Okay, a couple of things also came out this week. Of course, the government currently shut down as of midnight tonight. We're still waiting to see exactly what that might actually mean. And I kind of laugh about that because I guess unless you work for the federal government or in some other capacity, today really meant nothing. It did not move the needle, I don't think, on the government being shut down. I was able to get to work, do my job, treat patients, come home and run a podcast. So it'll be interesting to see what day 2 through 5 means for the US. But there were some other interesting news articles that came out this week. One most notoriously was the one from RFK and Trump on Tylenol and the connection with autism. This has been a very weird response. There's been a lot of weird things around this particular statement. I don't know if the science is true or not. I don't know yet. I don't think it's really clear. But I think the thing that bothered me the most as a clinician, let's just say Tylenol does cause autism in pregnancy, and coupled with other things like vaccines, there's really a toxic effect. Okay, let's just hypothesize that for a second. To say that, but then to provide clinicians with no help on how we're now to manage those patients is very counterproductive. So now, if a patient comes in to me and is pregnant and has legit infection, pain, other issues that we have to simultaneously manage while they're pregnant, because pregnancy doesn't just take a holiday for all other oral health conditions, what are dentists and physicians supposed to do for pain management? So regardless of how you feel about whether or not Tylenol has some correlation with autism or not, and hopefully the science will become more clear on what we should or should not be doing. Um, when we make these grandiose statements, when the government comes out and gives all this deep prophetic knowledge, the very next statement should be a guideline for moving forward for doctors so we know how to take care of the people who depend on us to make decisions. The bottom line that has now been left to physicians and doctors and dentists is that you just use your best judgment. I actually don't know what that means anymore. I don't know if I just do my normal protocol or if now I'm really stuck between a rock and a hard place. And should I happen to recommend Tylenol to a pregnant patient who does end up with a child with autism, will I be sued? And ultimately, while we have the best intentions to take care of people, it's always in the back of the mind of physicians and dentists. Thank you for attending my TED Talk in a bit of a soapbox, but I really feel like it's okay to make these statements, but you really are, handcuffing the people who ultimately care for the folks to make decisions about how to take care of them moving forward. So I really hope, RFK, that is next on your agenda, is to give us some guidance on how we can continue to take care of people, whether we believe the science or not. Another couple interesting story articles that came out. One, I think it's important to note there's been a pretty big campaign to remove some of the mental health questions that were required for a licensure. Now 60 different licensure boards, as well as over 1,800 different hospitals are participating in a program called Wellbeing First Champion Challenge. And this is to try to eliminate some of the stigma of mental health associated with different professions. So we'll see what that means. We think it should be fairly beneficial for dentists who want to pursue the profession and licensure not to be stigmatized by past mental health issues. The last story, because I'm just full of Susie Ray sunshine tonight, is HPI, as you know, has been putting out data since 2020 on the status of dental health practices and the general well-being of dentists in the US. Well, they came out with their most recent statistics. And I think the data is continuing to be pretty consistent. Definitely a tight fiscal squeeze for dental practices. The wait time for new patients to get into dental offices continues to go down, which I think says a lot about availability. You can interpret it two different ways, because at the same time, we're also seeing a constraint on getting in hygiene folks for staff. And that definitely continues to be very consistent in the data, is that most dentists are continuing to find challenges in bringing in dental staff members, particularly in the hygiene realm. But we had a pretty big peak of activity around the end of Q3, Q2 2023, 2024. And now we're just kind of seeing this continual precipitous drop of financial well-being of practices. I think I'm seeing it as well. So when I read this article, and it's at least refreshing to see that maybe you're not alone when you feel like September is now also translating to suck August and suck October. But we press on and we try to get more creative on the ways that we can make these fiscal responsibilities work. So with that, being as optimistic and what a ray of sunshine I have been tonight, that's the news.
And look how fast I am on that trigger.
That was really better than Chad. Thank you.
I know. Like, can
Really?
we just all admit that Chad has a really slow trigger finger when it comes to coming back after the news? And I feel like he might do it on purpose to you.
I think he does. He's always trying to screw with me.
Yeah, that's what I think.
Yeah.
We hate you,
sabotage.
Chad.
Yeah, we're on to you, bud.
Hey, you mentioned TED Talk. You know who actually did give a TED Talk?
Who?
Dr. Miguel Stanley.
Of course he did. He's amazing.
Of course he did. And also as a National Geographic host. I don't know if you knew that or not. Yeah.
One day I might be half as cool as his pinky.
I know, right? And the first thing I said is, like, my first question to him off the record was, so how does it feel to be an underachiever?
He said, I don't know.
Yeah. He would have no clue.
No idea.
And he said, see self.
Yeah.
Oh, man. Well, anyway, great great news segment. No, you're
Sorry.
right.
Usually I try to bring a little happiness to news, but
Yeah,
man,
yeah,
there's
there
just
was
nothing out there.
no, nothing there. And on top of it, you had the fire department at your office this week.
I
So it's
did. I
just
did.
that kind of a
Everyone was
week.
so concerned, which I genuinely appreciate. I got a lot of messages, but we had a gas leak. We showed up. We're right next door to a restaurant. This happens about once every year, every 18 months. We showed up and we walk in and I smelled gas, but I got to be honest with you, ever since COVID, the old sniffer just isn't as good as it used to be. So I doubt it constantly. And, I do think women in particular have a very keen sense of smell. So now I feel constantly questioning, do I actually smell gas? Do I not? So I walked in, I was talking to my associate and I said, did you smell gas? And he said, no, I didn't smell anything. And I said, okay, well, if I hear one more person mention it, then we'll call the non-emergency
Yeah.
number. And sure enough, not 5 minutes later, somebody was like, do you smell propane? And I thought, okay, well, I guess we got to call now. So mass evacuation of our space, which is hilarious actually, because they didn't evacuate the entire building, which had it actually blown up, would have wiped out 7 other businesses who are all humming along, not being bothered one bit, except for all the flashing lights that we brought in there. But anyway, all's well. We were able to get back to business, missed an hour's worth of production and appointments, but we championed on. So
And you're open again and back to September.
back to
October.
September. We had to cancel all the one patient. It was really unfortunate for that
We had to
one
cancel
person.
all our patients.
Yeah. Really unfortunate to close the month the way that we were able to. So
all right. Well, I'm going to go ahead and do an introduction here because, like I said, this is just such a great interview, and I'm really excited for y'all to see it. As I said, JB, if you don't mind queuing this up
you
for us
got it.
while I do this.
Well, it's just going to go straight in.
Okay. All right. Well, as long as you got the
I'm
trigger
ready.
finger ready. Okay, that's perfect. Well, as I mentioned earlier, this show is done in conjunction with our educational partners at the American Academy of Cosmetic Dentistry. We have so many great friends there and great clinicians that we're just so tight with. One of those people is Dr. Amanda Seay, who is obviously, as many of you know, an amazing clinician, an amazing educator. But this year, she's also president of the American Academy of Cosmetic Dentistry. And really, this program is her baby. She titled it The Future Is Now. It's April 16th through the 18th of 2026 in Aventura, Florida. But Amanda, as I said, most of you know her already. If you don't know her from what she's doing with her teaching group with Dr. Adamo Notarantonio in Charleston, or maybe you know her from the Coy Center, you certainly know her from somewhere as a key opinion leader and just as one of the leading clinicians and educators in the country right now. So the name of her teaching group is Impress, which she does, as I said, with Dr. Adamo Notarantonio. And most importantly about Amanda is she's my neighbor down in Charleston. So really happy to be speaking with her as we were. But the person that she brought in to be the keynote, I completely see why this was her choice, because I was just so impressed, as we all were, as soon as the introductions were made. So Dr. Miguel Stanley is the visionary founder and clinical director at the esteemed White Clinic in Lisbon, Portugal, an internationally acclaimed dental center revered for its excellence. At the helm, Dr. Stanley leads a highly qualified team, attracting patients from across the globe since 1999. He focuses a lot on regenerative medicine, oral systemic health, digital dentistry, and as I said, just this man's passion for just I hesitate to use the word perfection in dentistry, but on the same hand, or I don't with him, because I really don't know anybody that strives for perfection in what we do as much as he does. As I said, he's done TED Talks. He's been a National Geographic host, just a world-renowned clinician, educator, leader, and inspirational speaker. And everyone would really be better off to have gotten to know him, and certainly to have been able to enjoy one of his courses, which he will be giving at the AACD in April. So with that, we hope you will enjoy this interview. And JB, anything to add?
I told my son about this interview and some of the famous people that he's a dentist for, which we talk a little bit about in the podcast. And he said, "Is he better than you?" And I said, "Yeah, he is." And he goes, "Well, why can't you be like that?" And I was like, "I don't know. I don't know.
Yeah.
I don't have a good answer.
It's hard,
It's not
to get me to say that, but I'm just going to blurt that right out. Yep. He's better than me.
He is. But aren't I lucky and fortunate to have been in the same room with him for an hour? I mean,
That's right.
All right, my dear, let's rock and roll.
Enjoy, everyone.
Miguel, thank you so much for being with us this evening. Really looking forward to connecting with you. It is our understanding that you will be the keynote at this year's AACD annual session, which is pretty amazing. I know that's exciting. We'll get to that in a minute, but in the meantime, would you mind just sharing with us your journey in life, dentistry, and understand you practice in Portugal? Tell us what it's like down there and how life is treating you.
Well, hey, it's really nice to be here. I'm just such a fan of everything you guys do at the American Academy of Cosmetic Dentistry, and a lifelong dream has come true of being the keynote. So thank you, Amanda. Thank you so much for inviting me. So Portugal's hot right now. Yeah, everybody wants to come to Portugal. I'm sure you're quite aware of that. Thanks to all of the work that I've been doing. No, I'm joking. No, look, my dad's Portuguese. My mother is from Manchester, UK. My mother's a redhead from England. I was born in South Africa in 1973. So I'm 52 years old. And I moved to Portugal when I was 9. And so I did my studies in Portugal and graduated in 1998. I didn't really want to be a dentist. I wanted to be a heart surgeon, inspired by Christian Barnard, the famous South African surgeon. So when I was a kid, he was our most famous person in South Africa, was this heart surgeon. And, you know, I just thought, well, wow, get to change body parts. Like, that was amazing, right? So I was always inspired to be a doctor. No doctors in my family. And so I missed in Portugal in universities public, and we had math, biology, and chemistry, and I missed by a few points in math because I wasn't very good at that. And so the only opening back then was a private dental school and the first year was the same as medical school. And I thought, you know what, I'll do the first year of dentistry, which was, you know, and I'll get equivalency and then I'll go into medicine. And in that very first year, I got a job as a delivery boy because I had a motorbike for a dental lab. And basically, I'd do my runs. I'd wake up at 6 a.m. and I'd do my rounds, dropping off teeth and dentures and crowns and bridges for local dentists in my neighborhood and in the city of Lisbon. And then I'd go to university and I just, hey, these guys have a pretty good life and it's pretty interesting. And there wasn't any information back there. Internet didn't even exist, right? So that was kind of my benchmark. And I made my friends and I'm going to stay with this. So I told my family. And so I became a dentist. It wasn't a lifelong ambition of mine. I had no network in dentistry. And in 1997, a year before I graduated, Dr. Ronald Goldstein from Team Atlanta, one of the fathers of cosmetic dentistry, came to lecture at my school. Now, I'd never seen anything like it. Because American education is by far the best education in the world. I was in a little university in Lisbon. It's a good university. It's pretty good, but nothing close to how you guys are trained in America. It's the greatest country in the world, and they have the greatest education system in the world. Hands down, American dentistry is the best consistently in the world, consistently. That's multifactorial. Of course it is. and I've lectured in 55 countries. I kind of know what I'm talking about. So with that said, I saw Ronald Goldstein just talk about it different. And he inspired me to become a speaker. I was blown away. One of those life-changing events. He's 91 years old now. And still, I think he did his last crown last year, because I'm good friends with Team Atlanta, David Garber, Maurice Salama, and those guys. I'm very good friends with them all, big mentors of mine. And so I was inspired to do this, and cosmetic dentistry wasn't a buzzword in 1997, and that planted a seed in my brain about beautiful smiles, because back then it was just the mechanics and, you know, tooth decay and gum disease and all of that stuff. And so that put a seed in my mind and sparked, I guess, my career. I went on to train in implant dentistry. I trained at the Brunemark Institute in Madrid, in Spain. In 1998, I did a 1-year residency in implant surgery, placed my first implant in 1999. So I'm an implant surgeon with training in guided bone regeneration for the past 25 years. So I lecture a lot on surgery, guided bone regeneration from a perio standpoint. And I also train in cosmetic dentistry in Madrid. So I'm also do a lot of cosmetic work, veneers, laminate veneers. So I pretty much wear two hats. And as a result of that, in 2002, I started building my team, very much inspired by Team Atlanta, to have a little, you know, again, there was no benchmark, but they were my benchmark, and there was no internet stuff. So it was just communicating. We did our first clear aligner case in 2004. So 2004, we were already working with clear aligners and interdisciplinary treatment planning for the past 21 years. And consistently just focusing on just good work, I guess, inspired by you guys, and just being a good boy, I guess, and doing a good job. It's pretty much it in a nutshell.
Well, Miguel, it is very obvious that you had some good inspiration. We are close to the same age, although, again, I win oldest on the screen. So
always
I'm really excited about that. But we are pretty close to the same era. And I will tell you that the person for me that did what happened to you was David Garber, and seeing what he was doing. Well, but what he was doing with slides that many presenters now cannot do digitally was just amazing, with multiple projectors and
the carousel.
Yeah, just unbelievable. And he was actually, a great inspiration for me. So I completely agree with what you're saying.
And those guys today, it's sad. There's a whole generation of younger dentists that have no idea who those guys are.
I know.
Instagram took it over, and the coolest guys with the nice watches and cars are now the benchmark. And it's so sad to see that these super scientists that really published on, the foundational, going back, Dennis Tarnow, the contact, the rule, the 1998 study, contact point to crestal bone, 5 millimeters. People don't even know that today. It's like these foundational scientific pillars of science that these guys put out there that allow us to do our craft today. So I always pay homage and respect and honor my teachers, because without them, I wouldn't know anything. And I'm now inspired by everything. I'm curious about everything. I'm learning from everywhere, and it's so much fun right now.
Yeah, another one of those people was Jerry Cheech. He's one that around that same time, it was definitely David Garber that just got me full on motivated. But then I saw Jerry Cheech, and he made it simple for me to start figuring out an algorithm in how to provide that kind of quality cosmetic care. So
I like that word algorithm, because I think what that early science came out, and I just remember citing Tarnow's paper of the 5 millimeter to contact, and then Team Atlanta expanded it to tooth to pontic, tooth to implant, implant to implant, that very seminal, and it gave you a mathematical formula to help you explain, study, understand, communicate with labs, all before digital came out. So yeah, man, it's important to know the science. A lot of clinicians out there are heavy on marketing, soft on the science. And I think that if you want to be, people say, how do you do what you do? It's like study, dude. Study.
Yeah.
Yeah, and let me say this too, because we have on the screen Dr. Amanda Seay, and we did not introduce her. So I first want to apologize to everyone, the president of the American Academy of Cosmetic Dentistry, but also someone who I think wants to bring a lot of those algorithms. She does it in her teaching. She's done it as a clinical instructor out at the Coyce Center. And so I think this team that is put together at the AACD, I think, and having you speak there, Miguel, is really, you know, the greatest way to pay homage to some of the greats that came, you know, before all of you and before all of us.
Yeah, and it's a true honor to have you, Miguel, as a headliner for our academy, because, you know, of course, we're called the American Academy of Cosmetic Dentistry. So cosmetic dentistry is a big part of it. But I think that I want to change the message, the consumer message that happens all the time, where people think that cosmetics is separate from doing good, responsible dentistry. Like, it's just part of it, right? Like, if whether you're doing one tooth or you're doing 10 teeth, don't you want it to be done the most conservative, minimally invasive way and have a beautiful result? I mean, that's just the goal for every case that we do and for every patient. So, you know, what I don't want is for people to think that cosmetic dentistry means that you're going to get 28 new teeth that are white. Cosmetic dentistry can mean from simple conservative bonding, straightening the teeth, changing your function, whatever it is. It's so much more than that. And so for me, bringing Miguel and just his philosophy, his purpose, and what he's done with his clinic, and just overall oral systemic health, total body health, like, I think that's such an important message. Whether you are, you know, a biologic dentist, holistic dentist, it is, I believe, going to be something that everybody will be talking about, and it'll be more mainstream. I mean, right now you hear so much about gut health, you hear about functional medicine. We're not hearing enough about the dental component and the systemic link, and what are all the things, what's traditional dentistry and what's wellness dentistry? What are the differences? And I think it's so important. So Miguel, like, I'm just excited. I've heard you speak several times, and I think the first time was, I don't know, probably 5-6 years ago. And I personally was not in a place in my career where I had really known much about biologic dentistry. And when I heard you speak, it just really resonated with me on so many levels. And then I had a personal story with my own daughter who became very sick, and took her around to all these different clinics. And at the end of it, we figured out what was going on, but her system was overburdened with mold toxicity, mercury, parasites, fungus, yeast, all these things. But it opened my eyes to how I could practice differently. So it's near and dear to my heart. Like, I am thrilled for the academy, but also for myself. This is a bucket list item to have you here and to do this interview with you. So thank you.
Thank you so much, Amanda. And I think the last time we were was at the Seattle Study Club, right, in Santa Barbara.
Yes.
And, you know, let's unpack everything you just said, just so the speakers and the audience can understand a little bit about what it is I'm seeing. And I'll try and break it down, because labels are dangerous, because I could say a word and the listener understands that word as something else. So we have to calibrate language. I think language is shifting nowadays around the world, and words have meaning for me. And I think it's important that we use the right and correct words. So let's talk about cosmetic dentistry. I have posters all around my clinic, and it says, "Health is the new beauty."
Mm-hmm.
Health is the new beauty. And so that's the first thing. I am old enough to have remembered grinding down 2 millimeters of all of the tooth structure to get, your
Break it on.
Yeah, I've been metal free. I was using, let's say Emax or lithium disilicate or zircon, but let's say lithium disilicate or the Empress, back in the day, IPS Empress, and it was 2 millimeters of thickness when Procera came out and all of that. And nowadays you can do it with 0.3 millimeters, right? So the technology, the quality of biomaterials, digital technologies. I'm the vice president of the Digital Dentistry Society. I scanned my first mouth in 2013. I've been using CBCT since 2007. We did our first case of digital smile design with Chris McCoachman in 2014. Then the Style Italiano group came out talking about conservative, minimal invasive approach. We've been documenting and have published on pre-treatment ortho as far back as 2004. Improving the tooth position to grind off enamel, less enamel, right? And it's a moral decision. I was in Shanghai, just timestamp. I was in Shanghai we're now in September, so I think it was the 8th of September for the FDI, which is the largest organization in the world. 35,000 people traveled to Shanghai to talk about dentistry. And my topic was the moral responsibility of the modern dentist in our profession. Meaning, how are we going to engage in the future a patient that comes in with this meta glasses on, that has an earpiece, and you're trying to say, we're just going to grind off all of your enamel and put on lithium disilicate, and you're going to look fantastic. And we do that in 2 sessions, and it's going to cost, $2,000 a tooth, and it's going to be amazing. You're going to feel fantastic. It's going to make you look better. It's going to craft these feelings. And the earpiece is saying, make sure he proposes pre-treatment ortho. Maybe at the end of the pre-treatment ortho, you don't have to file down 27 teeth, but only 3. And perhaps with some injectable composites and a bit of bleaching, you can save 70% of that budget. Are we ready for that? Because if the AI of the patient is, I want a minimal invasive approach, but I also want to be beautiful and I don't want to damage my health, why are we grinding off healthy enamel for profit? These are moral questions. Now, again, I live in Portugal. I am a capitalist. I love making good money, but not at the expense of ignorance of the patient or my greed, or just because other people are doing it, or there's some paper published in 2013 that made it okay.
Yeah.
So we have to upgrade our moral conscious understanding of what a healthcare provider is. And that means we need to be curious and empathic. We need to get out of our lazy avenue of comfort. And right now, if you're not uncomfortable about dentistry, you're not looking at things properly, because it's a time for change, radical change, and radical acceptance that right now, less than your patient, period. AI has changed. It's not going to. It changed it last year already. So everything you say is now rapidly under intense scrutiny. Now, let me ask you a little question. We'll get back to what you were talking about in a bit. This is not biological dentistry or labels you want to put in, okay? And we can talk about how $1 trillion food industry is now labeling food as GMO, pesticide-free, the Whole Foods, all of that stuff, Erewhon, all of these things. High-ticket patients that can afford a $100,000 smile makeover are definitely eating healthy food. How do you put that mindset into dentistry? Is my composite BPA free? Are there, what are the active ingredients in this luting agent? They're asking these questions. Is this ceramic going to leach? They're asking these questions. You've got a tech startup billionaire. I have a few billionaire patients, and I also do cleaning ladies down the street. I treat everybody the same. All right. So, and that's it. All right. But that's my business model, because I've only got one clinic. I don't have a network of clinics. It's not a savvy business decision, but it's how I'm happy. Portugal's a small country, and I know pretty much everybody in my community. So, and I'm sure like you guys as well, otherwise you wouldn't be on the panel. Now, where am I getting at? AI has really changed that. So let's go back to what it means to understand patient information and patient consent. Let's just go to that one. So let's say I go to Dr. A, and Dr. A says, oh, yeah, you just 27 laminate veneers or 28 laminate veneers overnight. My team of artisans can change your smile and you will feel. Now, let's say for 50% of the patient population, that is absolutely true. I'll give you an example. You've got a collapsed vertical dimension from excessive grinding, wear and tear. You've got stained yellow teeth with crack. You're 40, 50 years old. 100% that's the indication treatment. And if the teeth are in the right position, 100% and it's an occlusal vertical augmentation with a facial ceramic for aesthetics. No discussion. Okay. Software can do that. You can do monolithic, layered, whatever you want. But what if the vertical dimension is perfect? What if the teeth are just offset a little bit and a few aligners are chosen here? The patient's got beautiful enamel. Yeah. Everything's perfect. That's not the right indication, and we all know it. And that patient deserves to know that that's not the right indication. And the doctor has a moral responsibility to advise the patient that tooth movement first, bleaching, which goes against making money, which for a capitalistic mindset, when you have a bottom line and you're mandated to make money, is very difficult to choose. So perhaps the doctor that doesn't own their practice, that works for an institution that says you have to invoice this. I'm not saying any names, but if that's the mindset, that doctor's going to have a very difficult time, and he's only got two options: set up a revolution or quit. Because nobody puts a gun to that doctor's head and makes them do that. That's a tough decision. And I think AI is rapidly going to make that decision for the patients. Mm-hmm. And last but not least, you have the patients that they need very, very comprehensive, complicated things, but we can talk about that later. Now, usually patients that are doing these comprehensive big smile makeovers go to two practitioners, maybe three, mm-hmm. right? Shopping around, correct? Is that your experience?
Yes.
Yeah. Right? Mm-hmm. Okay. So if I've gone to one clinic A, B, or C, and I've had a really comprehensive checkup that involves an iOS scan, facial dynamics, you've got your module, you've got your 3D shining right now. That does not promoting any brands, but they now new scanners can check motion. They can you can put that on ExoCAD and automatically predict a vertical dimension raise, DS. It's all the software does it for you right now. You can superimpose a CBCT facial scan. You've got an avatar you can understand, and more than ever, sit with the patient and understand, predictably, not what makes most money, but what makes most sense, mm-hmm. right? From a mechanical perspective, I've always said that aesthetics without function, and I think David Hornbrook was who taught me that in 2005 in Chicago. I trained with Hornbrook in 2005. I did a course with him in Chicago, functional aesthetics. Aesthetics without function is nothing. So occlusion is the objective. And aesthetics without occlusion has no longevity. We all know that, right? So the social six idea, if you don't have good occlusion, is a ridiculous statement. So everything has to be occlusion driven. And if you don't know occlusion, stop doing aesthetics and go back to school. I'm sorry.
I think that's an excellent point, because when Amanda was talking about AACD being a cosmetic dental group, or at least that's the acronym, right? But in my experience as a member and attendee, it feels more like comprehensive dentistry. It feels more like the American Academy of Comprehensive Dentistry, because there's a heavy cosmetic focus, but you're hitting it right on, Miguel, that there's also all of this function and biomechanics and the biomimetic dentistry and all that stuff ultimately feeds into that final outcome, whether it's one single crown on number 9 or a full mouth rehab with vertical change. Like all of those things piece in. And the cool part about the curriculum through the Academy is how diversified it is in that platform. That you can go learn how to layer composite, but you can also learn how to do rehabilitations and occlusion management, deprogramming to get a new vertical, all of those pieces, because you've got these amazing instructors who have all of that experience sitting on their resume, ready to share.
And they're not seeing it. And just to your point, I'm sorry, perhaps just for clarification, in my understanding, there's two types of dentists in the world: single tooth dentists and full mouth dentists.
Yeah.
All right. So a single tooth dentist, they are 90. I'm a single tooth dentist when needed as well. But that's, the one tooth at a time, a filling here, maybe 2 or 3 teeth. So when I say single, 2 or 3 teeth at a time kind of stuff. Right. And if you are that dentist, I love it. I have them on my team. Those are the biomimetic guys, spend an hour and a half making a molar look like a molar and a central with that. I have so much respect for those dentists. So let's just put that out of everything I was talking about previously is about full arch restorative big case. All right. And be it over implants or be it over natural teeth. Okay. So obviously, and I wrote a paper on this, I called it the architect, engineer, builder. So since Roman times, we have, and most of the Roman structures are still up today. If you travel to Europe, you can see it. You didn't start with the building. You started with the architecture, a vision. And that's the reverse engineering capacity that modern tools allow us to do, which is a good cosmetic dentist has that in their head. They're looking at facial flow, facial contour, gingival contour, like the lips, the lip line, all of that stuff. How am I going to make the smile invisible into my patient's facial anatomy, right? And, what colors, that's the artistry. And we then have to know how to explain that to our patients. And that's thanks to DSD or test drive concepts. We can 3D print it and now allow them to test drive it. And it's boosted sales, which is so amazing. And sometimes patients come in and they only want one central. And actually the software tells them they need full mouth restorations, right? So it actually works in our favor. I actually think that it works financially more in our favor than the other way around. So 100%. I'm not saying that software tells you to do less, but when it tells you to do less, please do less.
Yeah.
There's nothing more rewarding for me than talking a patient down. It's very rare, but they come in and all they need is a bit of a liner and some bleaching, but they're ready to pay big ticket. And I feel really good about myself. Thankfully, most patients actually do need a lot. But I just wanted to get back to the point of the AI concept and then to get back to your point, Amanda, which is those patients that are shopping around, all that data, that digital data that is generated, the STL files, the DICOM files, the ExoCAD or digital lab software files, that information, that data belongs to the patient. So when the patient says, can I have my files, my lab file? Because nowadays it's the X-ray and the written stuff.
Right.
They actually only thinking X-rays and the patient form.
Yeah.
But how long before they start asking for all the files, my STLs, and you're like, why do you want the lab STLs? Because you said that you were conservative, and I just want to put it in an AI to actually see that you did do a conservative. That's happening now. So. I think it's a really interesting time right now. And that's why this meeting, I think, Amanda, that you put together, I'm so honored you invited me. And I'm really excited to see you and all the other speakers, is because right now is a very interesting time. We really have to get it right.
Yeah. So let me ask you this, Miguel, because, a big part of the academy, and I remember when I graduated in 2002 and I went to my first meeting, I just couldn't believe all the workshops we had. We had all these hands-on workshops, a lot of composite workshops. And I never knew that composite artistry could exist to this level, right? Or that we could offer composite. I mean, especially now with injection mold technique and everything, like you can literally treat every patient with any budget that they have to be able to offer them health instead of saying, I'm sorry, you don't have X amount of money, we can't do anything for you. So I want to ask you this, with this emphasis, because this is the part that just makes me so crazy, is I have met so many dentists, and not just young dentists, I'm talking seasoned dentists who have been practicing for a long time, who say, oh, I'm a cosmetic dentist. And I'm like, oh, that's wonderful. But they say, I don't do any composites. I only do porcelain veneers. And I hate to pass judgment, but in my head, I'm thinking kind of the scenario that you were saying before. So tell me how you're going to treat somebody's otherwise healthy teeth that have a malocclusion, say.
That's a great question. So I think, first and foremost, let's go to the treatment the diagnostic phase and the treatment planning phase.
Yeah.
Nobody on this forum and nobody watching this has ever been trained in finance-based diagnostics. Nobody.
Love that.
I actually coined that sentence in 2008, and I said financial-based diagnostics is killing dentistry. So you can't reverse engineer a treatment plan based on a serious diagnostic that restores ultimate biology, function, and aesthetics based on how much you got, because there's not one paper on earth that tells you how to do it. Moreover, there's also no papers that tell you how to cut corners or how to save money in a gold standard protocol. Like, what would you take out to make it cheaper? Doesn't exist. Yet everybody does it every day. So to your point, I think that once the very first thing that has to happen is, and I've been doing this for 25 years, people don't believe it, but the average first appointment at the White Clinic for 25 years is 1.5 hours to 2 hours. And that's what people don't understand, because it's a very comprehensive overall, because they come for full mouth health. We are oral physicians, not teeth mechanics. So if a patient comes in for one front tooth, fine, they will get that. But it's my duty to look at the periodontal, the oral cavity, the mechanics, the biomechanics, the TMJ, everything, right? That's my job. I'm a doctor. Now, many times a patient will come in for one tooth, and I didn't know that. And they end up doing a hell of a lot more work, right? So that's one thing. And the more tools and technologies you have to assist your diagnostics, the better that result for your business. Now, if it is a single tooth restoration, by all means, we say, look, you should do this. And that treatment plan should always consider these two factors. Your patient has all the time in the world, and your patient has all the money in the world. And of course, trust. But that's the third thing. Because we should never, a first appointment is a consult. It's a lesson. It's not a sales pitch. We should accept the fact that a patient might not want to do it with you. So in the first appointment, you have to explain comprehensive, state-of-the-art, advanced, minimal invasive, interdisciplinary, full mouth, oral physician-based, biology first, mechanics second, and aesthetics last dentistry. Then, if the patient says, thank you for that, I can't afford that, but can we pivot to this? Then you can decide, okay, fine, but at least there's a disclaimer that I told you how to do everything. Because think about this. There's patients that just come in and do one tooth, and then it pops off that one veneer because the mechanics wasn't done. And you said, yeah, but you're missing 5 teeth at the back. And they go, yeah, but implants are expensive. Just fix this. I've got a wedding next week. And you do, and it pops off the next weekend. You're in trouble.
Yeah.
Miguel, I'm sorry to interrupt you, because I think something so important has just been touched upon. And I think if there's an overarching message to all of this, it's that the American Academy of Cosmetic Dentistry and its constituents and its members and its accredited members have long stood, as JB said, for comprehensive diagnosis. And this is not about me, but I'm saying this for a reason. It was probably 10 years ago, the only time I had ever been invited to speak at an American Academy of Cosmetic Dentistry meeting, which I don't hold a candle to most of the people, not just on this panel, but throughout the AACD. I had never gone through the accreditation process, though I always tried to, live up to the standards of what was promoted. But I was asked to do a presentation. And when I said to the president at the time, I don't feel confident putting my work up here with the people that are going to be in this room with their photography, with their qualifications. I said, what I do feel really good about speaking about is going back to the diagnosis before any work is ever done. And so I got to do a lecture called Why Beautiful Cases Fail. And they allowed me to focus on the function and the diagnostics that are required. And the reason that I'm giving that backstory, again, is not because of me. It's because of what Amanda said and what you have just said, that probably the best investment that we make in dentistry is that time spent at the first visit. So during that lecture, I spoke about this 1 hour appointment that every single new patient gets in my office. I mean, I don't care who you are. You get an hour, not with the hygienist. You get an hour with me and my assistant. And that's it. I mean, and there's whatever diagnostic data we need, we're going to get. And we are not going to leave any stone unturned before we ever think about grabbing the handpiece. And so the reason that I think this is such an important message is for the people that are listening out there. One is, this is what the AACD is about. It's about people like you, Miguel, who are saying, yeah, you know, you may think it's unprofitable to have an hour and a half with a patient before you ever start doing any work. And I will say the most unprofitable thing that you will ever do in practice is jump into treatment too quickly. Would you agree with that?
100%, because you will avoid way more litigation, way more complaints, way more complications. And moreover, if you spend a little bit more time explaining the whole master vision, you'll be surprised at how many patients said, oh, I came in for one tooth, I want everything. I didn't know that was possible. And moreover, you'll have a clean conscience, let's put it that way, that if anything breaks in the future, you have a signed waiver saying, and that's the foundation. I don't know if you know, I created something called Slow Dentistry. I'm the founder of a Slow Dentistry movement. It's now in 43 countries. You can visit it at slowdentistry.com or slowdentisтрyglobalnetwork.org. It's a nonprofit. But anyway, and it advocates patient consent. Patient consent isn't a form that you just fill in. It's having that communication you were saying. And I don't sell what can go right. I'm literally selling what can go wrong. Because then when it does, it ain't a surprise. And I'm blessed with peace. So it's not about the work you do. It's about the complications you avoid. And we have to have a full mouth concept. Now, to get back to Amanda, just to answer your question, which was a very good question. I love composite. I've seen some, I've got patients from all over the world, 87 different nationalities, and I've seen bad quality composite fillings last 50 years. And those were done 50 years ago. I think composite's one of the most undervalued, underused materials in dentistry today. It's got a bad rap because it doesn't involve, but I'm going back to injectables, as you said, 3D printing. These things are amazing. They're affordable. They're super, super easy to do. You don't need a huge amount of skill if you just follow the protocols. And about a decade ago, and I'll be showing at the meeting, we've now got about 8-year follow-ups of nano-hybrid composite milled restorations. So let's go to the ultimate case of complexity. You've got a patient, mid-30s, mid-40s, with massive wear and tear grinding. So bruxer, big masseter, brachycephalic. They've ground their teeth down. And, the only thing that they can have today is a night guard if they have no money, or full arch lithium disilicate, right? I mean, that's it. You could argue the materials. I think zirconia is too tough, but I would argue lithium disilicate. I even have some cases in feldspatic, milled. My understanding is that the materials have to be equal. The top and the bottom have to be the same, and that's why I avoid zirconia. So about 8 years ago, Voco, not plugging anything, I had
great block though.
Yeah.
Sorry, but they gave. I work with them. It's a good company. Disclaimer, very nice, and they gave me this nano hybrid composite block. There's a bunch of companies. GC make them, Ivoclar make them, right? So nano hybrid composite, and they were used for single use indications, and this is 8-9 years ago. And so I looked at this. I had this patient, and I'll show the case in the Congress, and I was like, okay, I can't manually. He didn't have money. The guy, let's say his financial ceiling was 10K, right? And in Portugal, it's a fourth of everything you charge in America. So like an average monolithic lithium disilicate crown in Portugal is 1,000 euros average. Just so you understand, in Belgrade or in the Balkans, it's about 400 euros. Just so you understand, Europe, things are a lot cheaper, despite the product being the same. Anyway, where am I getting at? So in order for this guy to reestablish his vertical dimension, he couldn't afford the lab work, even just the lab bill. If I worked for free, he couldn't afford it. Okay. So what's the alternative for this patient? Injectables wouldn't have been robust enough. So we pivoted to milled nanohybrid composite individuals just glued with composite luting agent. Those have been in this guy's mouth now for 8 years. And it's a big shift by understanding not just new techniques, but also going back to composite as a long-term solution. And a very funny story is that he cracked one and he'd moved back to Vancouver, and his dentist called me up and he said, I don't know how to fix this. And so I said, what tooth is it? And I just sent him the STL file, the puck disc. He bought it, he acquired it, milled it, put it in, and it was done. So that's the beauty of digital dentistry, as well as also the shareability of these solutions. But I do love composite. I personally, at the clinic, I find spending, a long time doing handcrafted single central in composite. I think you should eventually probably charge the same as a feldspatic veneer, because it's chair time, right?
Yes.
So that's a personal decision. Do you love doing it? Do it. Do you want to outsource it? Outsource it. As long as you're not ruining enamel, then we're in the same camp. Now,
hold on. I got to stop you, because you just validated so much of what I do in my practice. I am a huge nanohybrid composite or composite miller in our practice. And it's so funny. I think sometimes we're met with resistance, but I think it's just such a fantastic product, and it serves such a valuable place in dentistry that we can't dismiss it. And you talk about strength, and I just want to back up just a little bit. I know Voco's a great friend of ours. I just also want to say that for those of you that haven't looked into it, Voco's block is the strongest on the market.
That's why I'm using it.
And it's really a fantastic material. It's 87, 88% filled. So if you have not, look into it, and it will open your eyes to something that's available and serves a great purpose in our practices.
And to continue that, so it's called the Grandio. It comes in a disc or a block, so you can use a 5-axis wet dry milling machine. It's very cheap to do. But here's the beauty of it: no oven, no sinterizing. You can do it chairside. So if you've got a Serec or a little like a VHF milling machine or whatever chairside, you scan, design, and some softwares now you can outsource that. It's very quick. You mill it chairside and put it in. We also know 3D printing is coming in with products as well.
Very similar products, yeah.
But my understanding is that the milling, so the reduction, I have a few friends of mine. I like to offer dentistry to my buddies and families and stuff like that. I'm sure you guys do the same. And so I had a friend who needed an implant a crown over an implant, couldn't afford it. So I said, look, I'll make you this temporary solution. And I milled a crown out of this nanohybrid composite, screw retained, right? Mm-hmm. So it actually had a hole through it, as if it was lithium disilicate, right, with the advantage of no oven, no baking, no lab costs, just chairside. And I screwed that in. It's been in his mouth for 7 years.
I
as a temporary
material over implants. I love that material over implants.
Yeah. And it's soft. It's got like absorber. Yeah. So Amanda, big fan of composites, also BPA free for the heavy duty holistic people out there. Now, regarding this holistic approach to biological dentistry or integrative dentistry, it's got many, many names. I'm very wary of labels and stuff. And I think we need to look back into the food industry right now. And there's a lot going on in America. I'm not getting into any of that, but just your coffee. This is organic. It's bio. It's locally sourced. We're hearing these words in our supermarkets, in our restaurants, at our local deli. What is that in dentistry? Mm-hmm. And you need to get ahead of this, because your consumers want it for their children. They want it for themselves. Millennials are getting information. So I read the study somewhere where it says baby boomers trust the doctor blindly. Gen Xers trust the doctor and Google. Millennials trust the Google and Instagram. And Gen will trust ChatGPT. All right, something like that. So, I just think that we need to pay attention to what the consumers are looking for, and maybe perhaps look into this concept of toxicity. Now, my angle here, and to get to your point beginning, Amanda, about what your daughter did, I gave a TEDx on this, and basically it's kind of like this. dentistry and doctors stopped speaking to each other 200 years ago. And I don't know if you know this, in January, Professor William Gianobili, the dean of Harvard Dental Medical School, created a group called the Harvard Dental Innovation Society. And I'm on the board of this, and I'll be traveling to Harvard in November. And it's a really interesting group of people and thought leaders and stuff thinking about the future of our profession. I was very honored to be a part of that group. And we're if you just go there, like the dental school is right next to medical, and at UPenn they're doing this as well. I'm an associate adjunct professor at UPenn, and you can see they're talking about mouth-body integration, and they're creating these groups, and Shine's doing it, and everyone's looking into ways of doing this, and everybody will have a different way of doing it. Some people start with airway, some people start with, different ways of this approach. But I guess what everybody needs to understand is, and it might come as a surprise to you guys, but teeth are actually part of the body, and we've been, just think of it this way, a heart surgeon that puts in a pacemaker. Okay, let's go to a heart pacemaker. First and foremost, the heart surgeon doesn't make more money or less money according to the quality of the pacemaker. He's not even involved in the acquisition of the pacemaker. All right, the heart surgeon and the anesthesiologist are not buddies. The anesthesiologist controls the quality of it, like a co-pilot pilot. There's a lot of redundancy in any operation theater in a hospital setting. Mm-hmm. But in a clinical setting, dentist is king. Everybody got to shut up. I'm in charge. Mm-hmm. The lack of any quality control in the dental setting in the last 30 years is kind of scary. Mm-hmm. So if your moral code as a dentist, and I'm not criticizing anybody, right? We all have ups and downs in lives. And sometimes in the beginning, you cut some corners to make, ends meet. We know, look, we're all adults here. Okay. But a lot of dentists are cutting corners that they shouldn't be cutting corners. And others are doing too much and they shouldn't be doing too much. And I think the American Academy of Cosmetic Dentistry, besides teaching people to do beautiful smiles, I think it should be responsible smiles. And more importantly, you can actually make more money doing the right thing. Yes. Like, seriously, you can make more money doing the right thing. And I'll finish with the anecdotal story at the end, but getting back to the quality of biomaterial. So that heart surgeon puts in the pacemaker and he will tell the patient, in 15 to 20 years, you have to change it. When an orthopedic surgeon puts in a hip, 15 to 20 years, you need to change it. The revision hip market in America in 2023 was a $6.4 billion industry. That's the second hip. Those second hips, 95%, I believe, are ceramic zirconia hips. Why? Because we are putting a bionic hip in. It has a mechanical lifespan, and we need to replace it. But somehow dentistry is for life. Like, why? Mm-hmm. Oh, and if it goes wrong, you have to pay for it, even if it happened 5 years ago. Why? Why did we allow this to happen? I know, fear of competition, fear of litigation, and we're going to battle every day, and we're just not being kind to each other. We haven't even been kind to our own sales pitch. We're so avid of selling stuff that we forgot to say, hey, this in 8 years' time, this in 10 years' time needs to be replaced. Sign here, whatever. And that's just a massive form of protection. Now, if it lasts for 30 years, yeah, fine. But some dentistry, some patients, and this is what I'm going to say on that, and I'll talk more on it in the conference. Some patients are battling autoimmune disease. Now, today, non-communicable diseases, which are diseases that I cannot catch from you, right? These are non-communicable diseases, are on the rise. We're talking about almost, 10x escalation since the 1990s. That's multifactorial. More people today have cancer than ever before. More people have Alzheimer's than ever before. More people have cardiovascular, et cetera, et cetera, et cetera, et cetera. Multifactorial, okay? But could a 30-year-old treat a patient who did a lot of dentistry 30 years ago, old implants, the first generation with periodontal inflammation, so I'm not talking about one tooth, because there's two types of patients that I believe, patients with all natural teeth and patients with a lot of dental treatments. Dental treatments are not natural. Okay. And then therein lies the almost 100 brands of dental implants in the US alone, continuously being upgraded, different surfaces. So if a patient, for example, in their 60s or in their 70s, that's battling autoimmune disease and has 40-year-old dentistry in their mouths, perhaps leaching certain things into their bloodstream, maybe we need to look into that, not as our problem, but as an ecosystem problem and as an opportunity to create something I like to call, and I published a paper on this, called revision dentistry, much like revision surgery in orthopedics, not even debated in medical industry. But revision dentistry is almost like we have to feel guilty that we're redoing something. No. That's the opportunity. And when you do it with 2025 materials. Okay? And it's that simple. That's pretty much my view of things.
There is no way that anyone listening today does not want to hear more of what you have to say at AACD.
I'm so excited.
I'm so pumped already about your keynote content and having an opportunity to network with you. Amanda, let's talk a little bit about the meeting. Let's talk about how they can hear Dr. Stanley a little bit
I've already
more.
blocked the dates.
What?
Yeah.
I've already blocked the dates while we were on.
Yeah.
Yeah, so our meeting is in April. It is in Florida, and it's at a beautiful location near so many wonderful things. But we're so excited about our lineup. I mean, Miguel, if you just copy pasted what you just said today, even I feel like thrilled, right? But
yeah, absolutely.
It fits so much in line with what we believe in. Also, I think the future, right? I think we have to look at the bigger picture, because it means so much more than what it means to be a cosmetic dentist. And if you think that you can offer one solution, one material, one technique to a patient, I don't think we're doing a service to our patient base. So we're thrilled. We always, if you haven't been to AACD, I think what sets us apart, there's so many good organizations and meetings, but I think what sets us apart that I still really think about when I first was a baby dentist coming out was that for a great tuition price, I was able to go under one roof and have so many amazing educators, like he was saying, Team Atlanta, like all these big giants in dentistry under one roof doing podium lectures to hands-on lectures. And so you're able to kind of sample and taste all these different things. And then you say, oh my gosh, if I really like to listen to Dr. Corky Wilhite, I can go see him in New Orleans and take his course. So I think it's a really unique opportunity to have all these different voices under one roof, to have the hands-on components from, you're talking about the porcelain materials, zirconia, to composite, to the lab part. We have technicians that are part of the academy too. And that's such a huge part of what we do, or technicians. So I became a better dentist when I learned what my technician had to do. I learned more from my technician of how to be a better dentist in many ways, cosmetic dentist, understanding morphology, coloring, shade, photography. So it's all of those things rolled into one, but probably the biggest thing that people don't always think about is community. And for me, I've grown up in that academy, and so much of, yes, I learn all the science, I learn all this great things, but how to implement it, to how to talk to my patients, how to run my business. When you go to these places, you're surrounded with a lot of like-minded people. And you meet people, some become your friends, some are friends that you see when you go to conferences, but it builds your knowledge base. It builds your circle. And those are the pearls, that the intangibles that you can't measure, but it has made me better at what I do. Like Miguel, you were talking about, don't ever assume the patient's finances, right? Or the time that they have. And while I learned all the science of treatment planning and diagnosis, what I lacked was the confidence in my verbal skills as a young dentist to be able to go out there and and tell the patients, I almost felt bad telling them, right? And so those are the things where you go to these communities and you're like, hey, I know you took this class with me, and I know you did this, and I know you do composite veneers. Tell me how you have this conversation with the patient. How do you do it in your practice? How do you do it in your practice? And it's just, those are the things that you learn so much from. It's not just the hard facts. So I hope everybody can come experience the education, but the community as well.
I can't wait to be there. I really, really can't. And, you're completely right. I always say that, the thing I love most about lecturing, and so it's a lot. I just want everybody to know I put a lot of effort into these things. I never give the same lecture twice. I'll be bringing something unique to you guys. I always put a lot of thought into this. I have a team of people. We have over 2 terabytes of documented cases over the last 25 years. We'll be covering everything. I mean, everything. So there'll be something for everybody at the presentation. From beginners to seniors, veteran dentists to the most critical we'll be talking about how to sell it, how to do it, and all new exciting opportunities, digital technologies, biomaterials, lab workflows, state-of-the-art reverse engineering workflows. We'll be covering ortho, perio, implants, ceramic implants, titanium, abutment selection, abutment design, smile, everything that's out there, modern. Because I like to think the White Clinic is a hub. It's like it's a tech hub. I'm always curious about stuff, and I want to share and also learn. And most of the magic is done at the water fountain or at the coffee table,
Absolutely.
or at night over a beer, and just connecting with people and making new friends. And I've made some of the nicest friends I have in my life today at meetings. And so that brotherhood and sisterhood is so important for us, because we have a very lonely profession.
Yes.
And we need to understand we're not alone, and there's a sense of community is so important.
Yes, for sure. Well, I have one last question, and I'm not sure if you can answer it succinctly in the time we have, but tell me about your famous patient that I saw a post of.
Which one?
I mean, just the biggest pop icon star that I grew up listening to, Madonna.
I love her. Yeah, I tend to always. I'm very grateful. I'm a big fan myself. I'm in awe of her. I don't usually talk about my patients, but yeah, for many years now. She lived in Portugal for a while, and
I didn't know she lived in Portugal, but I saw
she lived in Portugal for a while, and that's how we met. And we're still very, very close. And she's amazing. I mean, it's a global icon, to somebody I'm just very honored to know and take care of, and very, very privileged for that. But I told you I'd tell you a very interesting story, not related to M. About 2 years ago, I get a phone call from an agent in Beverly Hills, and said, Dr. Stanley, I'd like your opinion on something. And I have a client that has just gone to a clinic in California and was advised to do a really big case of 27 veneers. And I just find it excessive, and perhaps could you give me your opinion? I said, yeah, sure. So we jumped on a Zoom call, and a very famous patient, I won't say who, and quite young, beautiful. And I was like, do you, because the only reason that you'd need 27 would be a collapsed vertical dimension in order to raise the bite, right? And I was like, look, I can't, without a clinical observation, opine over a cell phone. It's just not going to work. So one private jet flight later, she's in my office here, and that patient only needed literally 4 aligners, a bit of bleaching, some contouring on one tooth, an internal bleaching on another tooth for 1/50th of the price.
Yeah.
And yes, grateful. Like, are you sure you're not missing a 0? And a lot of people say, how do I get a lot of these famous patients and stuff? Because they're not an ATM machine. They're not your ATM machine. They're not, you treat them just normal. be nice, be good. And that was the greatest. So this person in particular has a huge network.
Mhm.
Her friends, her colleagues, her coworkers, the people she works with in the industry. She's told the story to everybody. And the colleague, the person that thought that, hey, I'm going to give you 27 veneers because that's, what I do. That's just not a good business proposition. So I think the greatest attribute that a member of the American Academy of Cosmetic Dentistry, I loved your one of comprehensive dentistry. I thought that was great. Can do is just be good.
Mhm.
There's so much chaos in the world right now. There's so much pain and people suffering and war and separation and division. And America right now is hurting. It's hurting. We're watching. The world is watching what you guys are doing. And we need you to get your stuff together and be nice to one another. And if there's one community that we don't have to have any division on, it's making people smile.
Mhm.
All right. And I'm not talking about clowns. I'm talking about being
we used to have that reputation of being the most trusted profession. This was a topic we actually just talked about on our platform very recently is, how did we go from the most trusted profession to, what some people perceive as a group of salespeople?
Yeah.
Let's bring trust back into the game. And I wrote another paper on that. It's trust is the new commodity. And just think about this, going back to the original statement, an iOS scanner. I would argue that today only 60 to 70% of dentists in America have one.
Yeah,
right.
I think that's about right.
And if you ask them why, they will say, oh, the cost, the workflow, the extra, I'm good, I like blah, blah. But here's what no one's thinking. An iOS scanner immediately establishes transparency. Everyone's seeing that. Everyone. And that's a shared piece of data. It belongs to everybody, to the patient first, but everyone's going to see the poor quality prep, the over prep, the undercuts, all of that stuff. Maybe you're hiding something. And in 2025, 2026, if you can't be transparent about your work, you have already lost. Yeah. So that's the final message, not to scare anybody, but to inspire you to be better.
Yep.
As we close tonight, first of all, I want to thank you for your time. I mean, I know that your time is very valuable. You and Dr. Seay, thank you so much for the time that you've given all of us and our listeners. I took a lot of notes. You validated so many things that I think all of us do in our own practices, and it was just so refreshing to hear what you had to say. But there were a couple things that I just want to close with. One of the things you said, I love making money, but not at the expense of the ignorance and or greed. That was so powerful. Another thing was, if you don't know occlusion, stop doing aesthetic dentistry. Love it. Very true. Financial-based diagnostics is killing dentistry. How true is that? And you said something that I say in every single lecture that I do, and I just love hearing it, and I don't think anybody could hear it enough, and it is that we all need to encourage our profession to be physicians of the oral cavity rather than just tooth mechanics. So powerful. I mean, just absolutely love that. But I'm going to close with two words that you just said, and I think that they sum up everything. And that's be good. Just be good. So we want to just thank you again so much for your time. And it was such a pleasure getting to know you. And I blocked off April 16th to 18th as well.
Same.
So I'll see you guys in Miami.
Really quick, as we close tonight, AACD, because they're partners with Dentists in the Know, we have a pretty amazing deal coming out tomorrow. We'll be releasing some opportunities for a little reduction or a little help on the registration costs. So you guys can join all of us in Aventura, Florida in April of 2026.
And
Take care, everybody.
Just like to, if I can just say one last thing, Amanda, you are an inspiration to me as well. I follow your work. I follow your social media, your Instagram. And the message you put out with all the power you have, your family values, your values, it doesn't go unnoticed, your kindness. And, you're in the spotlight. And there's a lot of people out there that don't understand, I am sure, how difficult it is to be as amazing as you are, all that work behind the scenes, putting something together like this, and you do it with such style, elegance, and grace. And I'm profoundly grateful for how kind you've been and how elegant you are. And I'm at your service. So thank you, Madam President, for this invitation.
Thank you, Miguel. I can't wait to see you in person. Give
Let's
you
go.
all right.
Let's go. Thank you.
All.
Great
Good
show,
night.
everyone. Have a good. And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.